My presentation is titled Harnessing the Power of Digital Media to Accelerate Health Initiatives in Africa. And in this presentation, I'll be talking digital, discussing some of the potential opportunities and challenges associated with using digital media to accelerate the progress of health initiatives in the African context. I'll also be providing some ways to tackle the challenges, as well as highlight some digital health campaigns that have been on and some of the things that worked well, and also be providing some things to look out for when you're running a digital health campaign. Let me say that digital media, I know that you all will agree with me that it holds significance, an immense significance in Africa, particularly due to the unique healthcare challenges faced in the continent, from the limited access to healthcare services to insufficient medical infrastructure. And now in Nigeria, there's the Japa syndrome where people are traveling, healthcare professionals are traveling, and partly this is causing scarcity of healthcare professionals. And in scenarios like this, leveraging digital media can help bridge these gaps and basically enabling better health outcomes. So digital media is multifaceted. So there are different forms to digital media, and digital media is also known as new media, and it can be said to be digitized context from text to graphics to audio to video, and these content can be transmitted over internet or computer networks. Basically, digital media is an array of electronic communication platforms and tools, and so basically you're able to create, distribute, and engage with content via electronic platforms. Some of the digital media platforms we have social media. I want to believe that everybody knows what social media is, from Facebook, Instagram, Twitter, TikTok. One of the things that the COVID-19 pandemic taught us is the immense significance social media offers, especially as it relates to health promotion, providing convenient access to healthcare information, enhancing interaction and engagement, allowing users to also, connect with experts and participate in online health community. In this digital age, online community is fast becoming a thing. Another is mobile apps, and you have fitness tracking apps, symptoms checkers, mobile apps, and mobile health apps in particular are fast becoming game changers in this age. And you have apps that enable users to monitor their health, receive personalized guidance, and even access telemedicine services. And then we have websites and blogs. Unlike social media platforms where you advise that you should keep your content simple, concise, for websites, you're able to offer details about different health information, provide details about different health concerns and issues, providing a whole lot of information about various health issues. And it is sort of a repository, for medical information, medical resources, because people who go on website, especially health-related website, you would almost presume that they are actually actively looking for it, unlike social media where you could just be scrolling and just come across some content. So basically, websites and blogs can serve as virtual resources for people who are seeking for reliable health information. And then there is digital audio and video platforms. And these sort of platforms provide an avenue for experts to share health knowledge, discuss emerging health trends, and also host interactive sessions like YouTube, and also podcast platforms like Spotify, Apple Podcasts, and the likes. So one of the things that COVID-19 taught us is that digital media, like I said earlier, offers immense significance as it relates to health initiatives. It has the capacity to accelerate. Sorry, I'm trying to go to the next slide. It has the capacity to accelerate health initiatives and interventions. I'm trying to move my slide. Let me just stop sharing and let me share again. I'm trying to move my slides, but I think I have a challenge right here with my slides.
Okay, it's moving now.
Okay, all right, thank you. Thank you. Sorry for the break in transmission. So I was saying that you all agree with me that digital media offers immense significance when it comes to accelerating health initiatives, and there are a whole lot of opportunities that can be harnessed using digital media for health interventions, health initiatives, and health campaigns. And I'll be highlighting some of the opportunities that digital media offers. The first is the widespread reach. Digital media increasing, there's a whole lot of target audience that you can actually reach with digital media, with increasing access to mobile devices and the internet. Digital media has the potential to reach a whole lot, a vast and diverse audience across Africa. And one of the things that it does is that it allows health initiatives to disseminate information, resources, and campaigns, even to remote and undeserved areas, because you find out that people now have access to mobile devices, they now have access to internet connection, and with that, you're able to reach a vast and diverse audience. Another thing which is a game changer in the health sector is health education and awareness. Digital media can be used to provide health education materials, information in various formats. That's the beauty about digital media. You don't stick with one format. There are different formats, from videos, infographics, reels, carousels. You're able to inform people about health education and awareness. I said something earlier that one of the things the COVID-19 pandemic taught us is the capacity that digital media has, especially as it relates to health promotion. And one of the things that I see a lot of health organizations capitalizing on is health education and awareness using digital media. One of the things that Society for Family Health uses their platforms for, their digital media platforms, social media platforms for, is educating the public about different health issues, about different health concerns, keeping the public informed about these issues. And this information raises the information you put out, the health information you put out raises awareness about health issues. And also you can provide preventive measures, basically increasing healthy lifestyle choices. So one of the things that digital media can be used for, and one of the opportunities that it provides, is education and awareness, health education, health awareness, because you realize that sometimes people don't know these things and there's a need to inform them about it. So the education and the awareness is significant as far as the opportunities that digital media provides. Another which I really like is behavior change campaign. Digital media can be capitalized for behavior change campaigns. It enables you to target specific audience. Behavior change campaigns, basically you're trying to, make people adopt healthier habits. And so with digital media, you're able to target your demographics, because in every campaign, you are speaking to some persons. You have an audience, you have your target audience. And so with digital media, you're able to target specific people. You know your demographics, and you're able to reach them with digital media. In this age now, you can actually run a behavior change campaign on digital media solely. You can use traditional media, but digital media has a whole lot of different options for you and features, and you're able to run an effective behavior change campaign. Later words in this presentation, I'll be talking about some campaigns, health campaigns that I've been a part of, and some of the approaches that were carried out. Behavior change campaigns are powerful because with behavior change campaigns, you're able to promote healthy behaviors in communities. You're able to change attitudes. Another opportunity is community engagement. Community is powerful. Digital media helps to foster that. So you're able to foster a community, and this can be done through, support groups, building online community. An example is Baby Migo. Baby Migo is a a parenting community group for new mothers and pregnant women, expecting moms, and basically they share ideas. There are a lot of resources on that platform. For instance, like Baby Migo, for instance, a new mom, something happens, she's on a pregnancy journey and she needs maybe a certain advice. And on that platform, you would not be surprised to see somebody who has actually gone through that process that you've gone through. And so the person is able to share advice, share tips of how he or she was able to navigate. There's also that emotional support that you're able to provide through online groups. There are also groups for mental health where people are facing maybe they're depressed, and then you have a group of people and you're able to provide emotional support, share ideas, share insights, and it's really, really powerful. Another thing is partnerships and collaborations. Partnerships are very powerful. Collaborations, effective collaborations are really powerful. And with digital media, it facilitates that. You can collaborate with personalities, you can collaborate with individuals, and basically it helps to amplify your reach. There's this particular campaign. Basically, the campaign was trying to reduce COVID-19 vaccine hesitancy among healthcare providers. I'll be talking about this later also in the course of this presentation. And one of the things that they did was to build a coalition of partners. So basically, they got a whole lot of health bodies to come together and they leverage on their platform to share information. Basically, the idea and the goal was to reduce vaccine hesitancy among healthcare providers to the intent that you increase the vaccination and vaccine uptake amongst this particular group of people. And so with digital media, you don't have to be physically present to collaborate. There's that ability to collaborate with anybody from anywhere. But I always say something about collaboration. You have to be strategic about it. You can't just collaborate with everybody, right? And also you have to ensure that you're not selfish. It has to be a win-win situation. So even if you're looking out for influencers, you're looking out for organizations that you can partner with, you also have to look out for what they stand to get. So if you get, it's a win-win situation, you get something and they also get something, and that's one of the things that makes it effective. Another is the real-time information that digital media provides. Digital media enables rapid sharing of real-time information, updates, and alerts. And this is particularly very helpful during pandemics, during health emergencies, during disease outbreaks. Still referring back to the COVID-19 pandemic, one of the things that it taught us, or one of the things that we saw, is the ability to use digital media to provide real-time information. With digital media, we're able to get information about the virus, what it's about, number of people infected, which was really, really valuable and really helpful. Another is the interactiveness of digital media. Social media, online forums, and interactive apps allow for two-way communication. And so you can, communicate real time with your healthcare professional and also with the public. People can ask questions, they can seek advice, they can receive personalized health recommendations, and this fosters sense of engagement. Unlike traditional media where it's just one person talking, with this, you're able to engage with your healthcare provider and receive on-the-spot information and advice. Another, which is fast becoming, it is a game changer actually, is mobile health, telemedicine, and remote consultations. Mobile health hubs help to deliver health information. There are some that remind patients about medication schedules, some facilitate communication with healthcare providers, providing healthcare services, and basically enhances self-management as it relates to health. Also, digital media facilitates telemedicine services, and this enables enabling remote consultation between the healthcare provider and patient. Another is data collection and analysis, which is really, really helpful, especially if you are running digital health campaigns, you are running an intervention where you're capitalizing on digital media. You're able to generate on the spot a wealth of data, and this data can be analyzed to gain insights. So the health trends, your target audience, their preferences, their behaviors, and this is really helpful because it helps you to tailor your campaign in a way that suits your target audience. And so this would inform you. So you're not just running a campaign, you are running an informed campaign, and you're able to, have a more effective health intervention or health campaign. But then again, while there are opportunities where there emerge significant opportunities, there are also challenges and limitations to digital media. And the first is digital divide. Not everybody has equal access to digital technology. I think I was checking and I saw that Nigeria's internet penetration is a little over 50%. And this actually creates a digital divide because not everybody has access to digital technology. Some may have access to mobile devices. Their mobile might be lower end mobile devices. And so they don't have that access to digital technologies that you want them to, that you would need them to have. And this creates a digital divide. It can actually exclude marginalized populations, particularly those in rural or low income areas. And this is particularly a challenge if your target audience are part of that set. And so they really can benefit fully from the digital health initiatives or the digital health interventions that you're carrying out. Another is the limited internet connectivity. In different regions across Africa and here in Nigeria, internet connectivity may be slow, it can be unreliable, and even altogether unavailable. And so this can affect the reach and the effectiveness of digital health campaigns. Another is digital literacy. Now, digital literacy is different from educational literacy, but then there's that connection one way or the other. Now, there are some individuals, and this is particularly for people in the on these underserved areas, people in some remote areas. They may have low or limited digital literacy, and this makes it difficult for them to understand and engage with health information and navigate through digital platforms. And so digital literacy poses a challenge when it comes to, running health initiatives or health interventions using digital media. Another is language and cultural barriers. And this is particular for digital content, right? Not everybody, we don't all speak the same language, right? And so sometimes you find out that digital content may not always be available in local languages, or it might be available in language that your target audience understand, but then you're not sensitive to the culture of your target audience. So number one is the language. So you can, maybe you're running a health campaign, for instance, and your main language is English, but your target audience, part of your target audience are maybe Yoruba speakers or Igbo speakers in Nigeria. What you're going to see is that your communication will not be effective, right? Because while they understand what you're saying, right, they really might not be able to denote some of the things you're trying to say. Another is, while they understand it, there's that cultural sensitivity, for instance, imagery, symbols, and values. And so if you're running a campaign in Nigeria, you have to factor in the cultural intricacies of that region, as opposed to if you're running a campaign in Uganda. They are two different countries and they have different values. They have different things that represent different things. And so you have to take into cognizance the nuances, the cultural intricacies of where you are running. If not, if you don't, it's supposed a challenge to your health campaign or your initiative if you're using digital media platforms. So what you're going to see is that you're going to communicate, but you're not going to have that effective communication. And at the end of the day, you might not get the desired results that you want. Another is misinformation, which is a menace. It's one of the things I said that is an opportunity, is a widespread reach. But like a knife, digital media can be that. While you can reach a vast and diverse audience, you can also reach a wide and diverse audience with false information. Right? With digital media, people can easily spread misinformation and false health information. And there's a need for health bodies, health organizations, public health related, right, to compete with incorrect information. And this taking us still back to COVID-19. During the COVID-19 pandemic, there was this project that was on, and we're trying to basically monitor health misinformation in Nigeria. And the kind of misinformation that I saw about COVID-19 was alarming, from what you can use to prevent it. People saying all sorts of things. And some people just take these things hook, line, and sinker and don't try to check, is this right? Is this not right? And sometimes it could lead to serious health complications. So misinformation is one challenge when it comes to digital media, using digital media for health initiatives. And lastly is the short attention span. Now, in this age that we are, digital age, attention spans are really short. for instance, social media. If you're on social media, there are a lot of things grappling for your attention, right? And so imagine you are running an health campaign. People may not necessarily be actively seeking for maybe your products, your health service, or particular information. And so other things are trying to get their attention. So people sometimes don't have the time to read, even if it's a paragraph of text that you put out there. And so the attention span is short. And so capturing and retaining, so it's one thing to capture, it's another thing to retain. Capturing and retaining the audience attention for health-related messages can actually be tasking. But then again, while there are challenges, there are also ways to navigate through these challenges. The first that I would say is community Wi-Fi networks, right? I believe that it's possible to establish community Wi-Fi networks in areas with limited connectivity. And what they can do is these local networks can actually provide internet access to a broader population without really relying on individual data plans. I was watching a BBC documentary about the community in South Africa, just to say that South Africa has one of the highest internet penetrations. This community is called Mankosi community in South Africa, and I think it has about 12 villages. And what they did was that they built a stable and cheap internet connection, like a mesh network, and this was done with the support of the University of Western Cape. And so they have people who sell what they call vouchers. So if you are a community member or you a visitor, you can actually buy a voucher. And at the time I watched the documentary, the voucher was about 25 rands. And in Nigeria, if you are converting it to naira, that's about 8,025 naira for a month, which is quite affordable, because when it comes to internet, right, affordability and accessibility can be a challenge, right? But with that, you're able to settle accessibility and to an extent affordability. So community Wi-Fi networks can actually go a long way. Another is digital literacy programs, launching digital literacy programs that educate individuals in underserved areas about how to use internet, how to access information, how to navigate online platforms effectively. Another is offline content. Not all content has to be online, because in as much as there are a lot of people using mobile devices, but there is still that digital divide, and you want to be able to bridge that, right? So you can have some content that are offline, and you can develop mobile apps and platforms that allow users to access content offline. This is particularly helpful and useful in areas with intermittent connectivity, especially if you have your target audience in such areas. Another is fact-checking and verification, which I know that there are some fact-checking bodies, for instance, Africa Check, right, that basically verify some misinformation that are making rounds. And if you go to their platform, you're going to see some information that have been verified as false. So establishing more mechanisms for fact-checking and verifying health information disseminated through digital platforms. Also, public health bodies can also help to do that by using their platforms to, highlight some of the fake health news making rounds and just putting the right information, because people know platforms that they can trust. So for instance, if they see a World Health Organization, a Society for Family Health, putting a particular information that has been making rounds, some false information, and putting the actual information, there's that believability, attached to that. Another is engaging content. I think you can't overemphasize engaging content, especially as it relates to health, right? Sometimes people feel like because it's health, it has to be boring. No, because it's a health message, the more reason why you have to make sure it's as engaging as possible, because there are other things fighting for your target audience attention. And so if you want to get their attention, because they have short attention span, and you can't really do a lot to that. But what you can do is to grab their attention. How do you do that? By ensuring that your content is engaging. If it's an app, it's interactive, right? People can navigate easily on your platform. If it's social media, right, it's engaging, it grabs the audience attention, it's captivating. But make sure if it's social media, you keep it as short as simple. You make sure it's concise, right? You can mix and merge different things, interactive features. You can, if it's social media, reels, videos, you can also adopt storytelling, because we are humans and there's that emotional side to us. And so you can appeal to their emotions by, using storytelling. People like stories, using storytelling, creating content that sort of, tells stories. Another is hybrid approaches. I'm sorry, Comfort, how many minutes do I have?
Like we discussed, yeah, you had 20 minutes, but
Now,
I think
so how many minutes now?
you're 4 minutes over time already. But I think we can take how many slides do you still have?
I think I have about 2, 3 thereabouts.
Okay.
Okay, so
I
let me
think
just.
I think you can go.
Right.
You can go ahead.
Thank you. So another is hybrid approaches, right? Combining digital media with offline strategies. And hybrid approaches are really effective for areas with limited internet connectivity. So you can do social media community events. For instance, Society for Family Health is implementing a project, is the Delivering Innovation in Self-Care project. And as part of its demand generation strategy, right, it's an hybrid approach. So they do above the line digital media, very big on that. But there's also below the line where they go to communities, they are community mobilizers that go inside the communities to educate them about family planning and in particular self-inject contraceptive. So adopting that hybrid approach, particularly if your target audience are in those kind of underserved areas. And lastly is government policies. Government implementing policies that promote internet accessibility and affordability. And so I just want to highlight some campaigns that have leveraged digital media that I've been a part of, and the approach highlight that I feel like was really beautiful that was used. The first is the COVID-19 vaccine hesitancy project, right? The idea was to increase COVID-19 vaccines of healthcare providers in target locations. So the target audience was healthcare providers, and the goal was to increase COVID-19 vaccinations. The platform used social media influencer engagement. Now, what I liked about it is the collaboration. So basically, what the project did was to get health-related organizations, public health-related organization in which Society for Family was a part of, and they used their platform, to churn out information and content. Imagine the kind of reach you're going to get when you have organizations of that caliber coming together, to promote one cause, which was increasing COVID-19 vaccinations among healthcare providers. Because if healthcare providers don't take vaccinations, how do you expect the normal person, to take the COVID-19 vaccine? And so that was really powerful. And the contents were being promoted as they were put on their platforms. It was being promoted. So collaboration was really seen, and it was really beautiful when the project adopted that. Another is this Delivering Innovation in Self-Care project implemented by SFH. Basically, the main goal of the project is to increase self-inject uptake. And the target basically is women of productive age. The platforms use social media, web, there's the chatbot, there are online agents. Now, the approach I like for me is the hybrid approach, right? Like I said earlier, they don't just use social media. There's also the below the line, the community mobilizers that go to the community, talk about the product, that's the self-inject contraceptive, as well as even online. There are also offline strategies like working with Viamo. So the project works with Viamo, a platform that allows people who are Airtel users to dial a particular code and be able to access information for their first 10 calls in the month. Every month it's free. The only challenge is that it's largely for Airtel users, and you're able to get information about self-inject contraceptive and even other family planning method, which is so the approach is really effective. And so let me just, I'm almost done. I have, I think, just 2 more slides. Please, Comfort, just bear with me. So I'm just going to be highlighting some things to look out for when you are creating a digital health campaign. The first 2 things is your objectives and your target audience. Who are you talking to? You can't be talking to everybody, right? You would have specific demographics that you really, like they're your main, audience. And so you have to define them. What do they like? What are their behaviors? What are their needs? How do they, navigate through online platforms? This helps. This where persona, drawing their personas comes in. It helps you to tailor your campaign effectively because you're not talking to everybody. Another is clear objectives. You need to know exactly what you want and what you're doing. And this includes setting your measurable goals. What are your goals? Are you trying to increase awareness about a particular product? Is it a health product? Are you trying to promote behavior change? Are you trying to just drive website visits? or what exactly are you trying to do? So having clear objectives helps you, because you know when you have clear objectives and you know your target audience, you know you can't be on every platform, right? Also, engaging content. I think I've stressed that before now. Make sure you develop compelling and relevant content. Like I said, because it's health information, health products, whatever health related thing it is, doesn't have to be boring. The more reason why you have to make sure it's compelling and can drag the attention of your target audience, because a whole lot of things are grappling for their attention. Another is mobile optimization. Many people in this age use their mobile devices to access information. So you have to ensure that your campaign, whatever it is you are trying to push, is accessible and user-friendly. And then your platform selection. You can't be on every platform. You can't be on every social media platform. Once you know your target audience is or are, and you know your objectives, you know that there are platforms that your target audience spends their time. And that's the kind of platform that you should target. And another is testing and optimization. It cannot be overemphasized. Iterate, right? Because you have a strategy doesn't mean that you're going to follow it hook, line, and sinker. It's not cast in stone. As you are running your campaign, if it's a behavior change campaign, you're going to realize that some things are not working and you need to adjust. And then again, you're going to realize that based on result, these are the things that are giving you the numbers and you have to adjust, right? So make iterations, test, optimize, and lastly, collaborate. Collaboration doesn't mean you're weak, actually means you're strong, because you're able to identify people who speak the same language with you. And by this, I mean that people who you can find your target audience with them. You know that coming together is going to be a game changer for the health campaign you're running. So find people that you can collaborate with. Ensure that it's a win-win thing. It's not just about you, but they can also gain from that and get as much effective feedback as you can. Feedback is a gift, right? So get as much as you can and use them. And in conclusion, I just want to say that the potential of digital media to revolutionize healthcare is undeniable. We cannot deny it, because it allows us to transcend beyond the traditional barriers and also create innovative solutions. And by harnessing the capabilities of digital platforms, we can bridge the gaps in healthcare access, services, delivery, and also information dissemination across Africa. However, transformation cannot be achieved in isolation. It calls for unified and collaborative efforts from governments, healthcare organizations, technology experts, and community. And through effective collaboration, we can maximize the benefits of digital media and create a synergy that propels us towards a healthier Africa. Now, needless to say that the real impact lies not only in technology itself, but in how we effectively leverage it to improve lives. Thank you so much. I'm sorry for going over time. Over to you, Comfort.
Thank you very much, Bade. Thank you. This was a very, very elaborate section, and I think you basically covered all the questions that I had in mind. Well, that is a very great one. Thank you so much. So we'll be going into a question and answer section for Mrs. Bade immediately now, and then the person to moderate that Q&A session is our head of product, Israel Ayodele. And please, if you have your questions, kindly go to the chat section and type in your questions there, and then we'll read it out. Or if you'd like to ask your questions, you'd like to speak, please just raise your hand, and we would enable you to speak for that question. So Israel, you have the floor. I'm sure you have a lot of questions for her.
Hello. Good evening, everybody. Hi, Comfort. Can you hear me?
Yes, I can hear you, Israel.
Oh, great, great. So I'm trying to adjust my camera to turn it up. Good evening again, everyone. And thank you so much, Mogbonjubade, for your insightful session. Our team is currently leaving some comments or remarks in this chat and in the Q&A section. So if you have questions for Mogbonjubade, please leave your questions in the Q&A section. So it will be easy for our team to collate them and I will be able to ask or direct the questions to our speaker for her to answer. So while we're waiting for others to drop their questions, I have a couple questions, although your presentation was very insightful and so detailed that the questions I had in mind at the beginning, when I saw the topic, you practically gave answers to them. But I think my question would be, or is around the, you mentioned something, you mentioned about using carousels. I think basically you talked about the marketing strategies that can be used for introduce new solutions to users or people or clients or patients, as we might call them, that may need these services or these innovations in Africa. So I just wanted to ask you, in a situation where, well, of course, on this call or this webinar session today, we have healthcare stakeholders all around, I think from different countries, even beyond Africa, that are listening today. And maybe not everyone is a marketing strategist, or maybe not everybody has a lot of marketing insights, but they are healthcare stakeholders. So what would you consider to be the key metrics that stakeholders in the healthcare industry should be looking at to be able to say what we're working on is reaching the right audience, in terms of how we are making campaigns, trying to reach them? What are the metrics stakeholders should be looking out for to hit the right target, or to be able to determine that this thing is reaching the right audience? Thank you.
Thank you, Israel. So it depends on your campaign and the goal, right? So for instance, if you're trying to raise awareness about products, a health issue, for instance, your metrics can be your reach, right? How many people you've been able to reach with your content. It could also be the impressions, right? How many times your content popped up like on people's feeds, right? Then you might also want to look at the engagement, but that's really not for awareness, because you're just trying to raise awareness. But if you're trying to, for instance, increase conversions, maybe to your website, right? Your metrics could be number of link clicks, for instance. So how many people are clicking the links that connects to your website. And so at the end of the day, it just depends on your objective. I don't think there's a one size fits all in terms of metrics. That's why there are different metrics. So it's just knowing your goal, right? And with your goal, it's easy to define what your metrics or what you should look out for. So bottom line is there's no one size fits all. It's just knowing what your goal is, and with your goal, you're able to determine what is the right metrics. Because what can work for me might not work for you necessarily. So it's just knowing your goal and what works for you, basically.
Okay, all right. Thank you so much for that. So you also mentioned in terms of effective healthcare and how it is not just all about fighting vaccine accidents, but then how in a situation where in Africa particularly, let's say user education is quite low, or education for those in the last mile areas is quite low. So how can stakeholders fine-tune the messages, their campaigns, to ensure that it actually is able to, those persons in these last mile areas are able to understand the specifics of what they're looking at? So I know that you have a lot of experience working with Society for Family Health, and I understand the fact that your organization does a lot of outreaches to these last mile areas. So do you have practical examples of how you were able to streamline these campaigns to meet the target audience and meet them in their particular knowledge of understanding?
Thank you, Israel. So I'm going to give an example, a practical example. So currently I work with the DICS team on societal family health, and basically the DICS project is delivering innovation in self-care project. And one of the main goals of the project is to increase self-inject uptake, right? And their target areas is not implemented in every state across Nigeria, across select states in Nigeria. Now, we understand that there are different, we have like this demographics, right? For instance, in Oyo State, while we are running campaigns online, because the primary language is English that we use for digital content. But then again, there are people in that location that might not necessarily understand that. So what we do is that we also have the below the line, which is really robust, where we have community mobilizers. Now, the idea is to raise awareness, right? So we want to raise awareness about the self-inject contraceptive, because people can't take up the contraceptive if they don't know about it, they don't know the benefits. So there are community mobilizers who go into the community as part of the below the line strategy, and they actually talk about family planning, highlighting also the self-inject contraceptive. And these community mobilizers are part of that community. So it's like you know them. It's not like they are strangers from another place. And the language, right, they are speaking is something that if they have to switch, they would switch, right? So that the audience and people they are talking with understand. And so they're able to, talk about and create awareness about the contraceptives. That's why I highlighted hybrid approaches, right? Just making sure that you need to first, once you know your target audience, you know that because not everybody is not all your target audience are in that remote areas. There are people that are online, that are internet savvy, that you can communicate with maybe, for instance, English language, and they understand where you're coming from. But there are people that you really have to go into those communities to meet with them, right? And then you have to have the approach for that. So understanding who your target audience is, if they are mixed in that set, then you have to look for offline approaches that would work for you. And so just knowing who they are, if they are mixed, if you know that you can't find all of them on online, which is really possible depending on the kind of campaign, then you have to find approaches for going to meet them, because sometimes you actually have to go to meet them. And so it depends on your target audience, where they are. If you cannot find them offline, then you can devise other approaches. Another thing that we do is we also use traditional media. I know that we just digital media, but we try to merge and mix the media platforms. There's traditional and there's digital, and there's the partnership we have with Viable, where people can just use, because you can be using a low end or a low entry mobile device, and you might not be able to see some of our creatives online, but by you just dialing the short code and navigating through that, you're able to receive information about the self-inject. Sorry, I don't know if that answers your question.
Yes, it does. Thank you very much. So we have been getting a lot that we need to wrap this up, but then I think in just about 2 minutes, if you could provide answers to this. Dr. Jennifer typed in the chat, in the quick Q&A section, that digital media plays an important role in Nigeria and other African nations. And she said, especially considering their substantial youth population, where approximately 50% of individuals are below the age of 18. So she's saying that, however, with the widespread availability of digital media, it is imperative to prioritize the safety of young children. So
parental controls and monitoring, encouraging parents to adopt control tools and software that allow them manage and monitor their children of online activities. Also, on the part of the creator, is age appropriate content, right? Content creators should clearly label content that this is appropriate for a particular age group, and this labeling can also help parents and children select content that aligns. Also, strict settings, teaching children to set their social media profiles to private can also help, making them only connect to people that they know personally, and also letting them know about the potential risks of just sharing their information online, and how to, control that, avoiding oversharing. I think these are some of the strategies that can be adopted. Thank you.
All right. Thank you so much. Thank you so much. I believe Dr. Jennifer, this she provided enough answers to your question. Thank you so much, Mogbonjubade, for, sorry if I pronounced that wrongly. Thank you very much for
But it's fine.
this. Okay. I think that's pretty short and nice. Thank you so much for participating in this session. Over to you, Comfort. Thank you.